Good morning. My name is Leah Rafanti, Leahffanti. I'm a CTU field representative, and I represent all of our citywide CTU clinicians. I also am a social worker myself. We're here today because children in Chicago public schools need dedicated social work and nursing staff to meet their mental, physical, and emotional needs. And the leadership of Chicago public schools are leaving money on the table that could and should be used to fully staff our schools. This morning, you'll hear from social workers, nurses, and experts who will tell you more about what they are experiencing in the schools and what CPS CEO Martinez should be doing to address it, but has failed to do so up until this point. First, we're going to hear from Sheena Shukla, a CPS social worker. Thank you.
Good morning, everyone. My name is Sheena Shukla, S-H-E-E-N-A-S-H-U-K-L-A. I'm a school social worker at CPS. I want to highlight the diversity of services that we offer as school social workers to make it clear why CPS needs to opt into the Healthy Schools Medicaid Expansion Program. CEO Martinez and CPS, please note that this is a source of revenue that has not been opted into, even though it's been available for more than a year. As a school social worker, our professional duties include providing services for students with disabilities, students with documented mental health diagnoses, and students in need of crisis intervention services. More than often, our students experience a lack of access to mental health services outside of school. This is why I work in Chicago public schools, since I know that schools are an anchor of support in underfunded communities. School social workers are often the first person that students go to when experiencing mental health crises, such as experiencing sexual assault, expressing suicidal ideation, or witnessing gun violence in their neighborhoods. If social workers are positioned to help those in crisis, why isn't CPS staffing us at proportional levels with the entire student population in our schools based on National Association of Social Work guidelines? As frequently discussed in news publications, we are in the midst of a youth mental health crisis. Nearly 20% of high school students report serious thoughts of suicide, and 9% have made attempts to take their lives. Only 51% of children who have documented mental health issues receive treatment. And of those, 58% receive mental health treatment services in schools. Thanks to the hard work of the Healthy Schools campaign, a national nonprofit organization working to change policy to create healthier school environments across the country, school districts are able to do more to support our students' mental health. The Healthy Schools campaign in Illinois worked to pass a new policy in April 2023 to allow licensed professionals such as social workers to bill Medicaid for our general education students. What this means is CPS could be billing for additional money to be reimbursed to our school district that would pay for social work services that we're already providing our students. This is a source of revenue that could and should be used to fund the therapy we provide our students. While this has been in effect since April of 2023 and the law allowed for reimbursement back of 2021, CEO Pedro Martinez and Chicago Public Schools have failed to take advantage of this additional funding to support our students. In Illinois, school districts that opted into Medicaid expansion programming received $17.8 million in additional Medicaid revenue. By CPS opting into Healthy Schools Medicaid expansion programming, we will receive the critical funding for social work services for every student who's in dire need of mental health services. Our students deserve better.
Thank you. So just to drive the message home, remember in 2021, the Illinois Department of Healthcare and Family Services submitted a state plan amendment to expand the state's school-based Medicaid program. This was approved as of April 2023, retroactive to July 1st, 2021, and this amendment allows Illinois school districts to bill for eligible health services provided to all students enrolled in Medicaid, not just for special education students who receive services through their IEPs, their individualized education plans. So thanks so much to Sheena for taking us through the money that's left. Right now we're going to hear from Stephanie Steele. She's another CPS social worker, and she's going to tell you a couple more personal stories about how this is affecting her work, her school, and her students.
Hey everyone, I'm Stephanie Steele, Stephanie, Steele. I'm a school social worker at Chicago Public Schools. And I want to tell you about how, as my time as a social worker, it's not the trauma that I hear back to back all day long that gets to me. It's not being able to help all of my students who are asking for it. Have you ever had a student look you in the eye and ask you for help and have to say to them, is it an emergency? Because if it is, I'm going to find time. But if it's not, let me try to put you in the next couple weeks because I've got students booked back to back all week this week. Because that is my day every day working between two high schools. I am triaging like I am in a hospital to determine who gets help and who doesn't. Every time I walk into a classroom full of students, at least 3 other students ask me, Miss Steele, can you put me on your list for today? Or Miss Steele, am I on this schedule? Or Miss Steele, can you add me to the students that you see? Because I really need help. Literally, students show up in my office before the first bell rings and they say after school, while they're waiting on their sports and their after school programs, just to have a session with me. It's gotten to the point where my students will see that I'm busy all day and say to me, Miss Steele, it's cool. Are you staying after school today? Because I'll just talk to you then. Can you imagine kids 14 to 18 years old asking to stay after school just to receive school social work services? Well, we have access to this additional funding that CPS has not taken advantage of. So I have to pick and choose who gets social work support and who doesn't. Because you haven't taken advantage of this CPS, I want you to come to my schools and I want you to pick who I see and who I don't. I'm wondering if you will come and you will choose the student who watched their best friend die right in front of them, or the student who's currently unhoused. Maybe you'll pick the student that experienced sexual trauma, or the student who got a phone call in the middle of the school day that their house was shot at and they're not sure if all of their family members are alive. Or you could pick the student that's actively having an anxiety attack, because I'm tired of having to pick and choose between all of those scenarios and more. And if you think that I am exaggerating or this is extreme, I am not exaggerating. These are our kids' everyday lives. All of these things have happened in my school just in the last 3 weeks, and our school year is just getting started. I want CPS to come choose, because I shouldn't have to. No human being, let alone a child that has the courage to ask for help, should ask for it and not receive it. I want you to imagine something for me. I want you to imagine that you go into work today and you find out that one of your coworkers was killed. And then you go into work a month later and you find out that your best friend at work was killed. You go in a couple weeks later and the person, they work in the office down the hall, they were killed. And let that happen over and over again 6 times and tell me how you would function, how you would get through your day. Because I have worked at a school where 6 kids were killed in one school year. And at one of my current schools, 3 of our kids were killed just last year. It's a small schools community, so every student knows each other and every student needs support around this issue. Yet I have to pick and choose who can be seen just because there aren't enough hours in the day. My kids are turning to really unhealthy coping skills because I am the only school social worker in the building and I'm not even there every day out of the week. Just last week, while I was in the middle of 2 suicide assessments and a neglect assessment, I had a kid. He kept coming, knocking at my door, trying to see me. But I was in triage and I was in all these crises. And you know what? They had to come first. So I kept having to ask him to wait. By the time I finally got to him, he was really upset. He had been skipping his classes all week, getting into arguments with his peers, and just not able to focus. But when we could spend some time together, you know what he figured out? That he was just sad because he missed his friend who was murdered that went to our school last school year. All of my students' behaviors that impact their school during the day, these are a result of the trauma that they experience. I already do not eat. I do not use the restroom all day long, and I do all of my paperwork after school, just to see as many kids as I can, back to back all day long. I can't keep working like that, but I also can't tell my kids no. So at this point, I'm asking you, CPS, you, Pedro Martinez, to come to my schools and explain to my students how you could have had more school social workers for them and how it could have cost you nothing. And you chose not to, because I am tired.
Thanks, Stephanie. So there's money on the table that CEO Martinez is leaving there. Remember, this is money retroactive to July 1st. Money that's retroactive to July 1st, 2021. And he's leaving it on the table. Thank you, Stephanie. Next, we're going to hear from Latesha Newson. She's also a social worker and a licensed clinical social worker, and the board president of the National Association of Social Workers. We're very pleased and lucky to have her here. Thank you.
Good morning. My name is Latesha Newson, Latesha-Newson, and I am a clinical social worker, mental health practitioner, advocate, and current board president of the National Association of Social Workers Illinois chapter, an organization representing 25,000 social workers in Illinois. And I am also, most importantly, a former CPS student of Richard J. Oglesby School. I am proud today to be standing with our school social work members and leadership and members of CTU to call for safe school environments. Last year, I had the honor of being appointed by the mayor to the Working Group for Treatment Not Trauma, which has resulted in the reopening of our public mental health clinics and a non-police co-responder model for mental health crisis. We conducted several community listening sessions across the city and heard from youth as well as their parents regarding the significant need, overwhelming need for mental health services. Recently, NASW Illinois completed a grant-funded research project by Intelligent Community Initiative to evaluate safe school ratios based on actual workload analysis. A report we are happy to announce today is complete and ready to be published. A report we are happy to announce today is complete and ready for Illinois school districts to utilize. The new proposal is based on a workload-based staffing model designed to address current mental health needs. It is critical that we not only address the needs of students with IEPs, but also the needs of students in our general population that currently lack consistent mental health supports. For CPS, a student population exceeding 300,000, our model estimates that 2,031 social workers are needed to adequately meet the needs of students. This number reflects conservative estimates, assuming that 20% of general education students require biweekly support. However, given the level of trauma many students experience in Chicago, we believe this percentage may actually underestimate the true need. Based on needs-based analysis, CPS is currently short over 1,400 school social workers to build safe school environments. This is an absolute disservice to the needs of the students and their families, and a direct disinvestment in their future. Implementing adequate ratios of school social workers to students will ensure that the unique needs of students are met, that we start finally addressing the root causes of trauma in our students. With the Illinois Medicaid Plan Amendment by Governor Pritzker, CPS now has the mechanism to fund such a transformation that would promote healthy and thriving students, schools, and communities. Whether CPS is failing to capture one penny or $1 million, it is inconceivable that CPS would take it would be unconscionable, that CPS wouldn't take every step to address the immense trauma our students are facing. It's time that CPS bridge the gap and move to a holistic approach in meeting the needs of its students. This is an opportunity to make an indelible investment in our children and youth, an opportunity to invest in their overall wellness, not just their education. When I think about our children and our youth, I think about the perspective and the greeting by the mighty Masi tribe in Africa. Their greeting is simply Kanserian Injuri, which means, how are the children? They believe that their greeting acknowledges the importance of children's well-being and the belief that the health of the next generation determines the future of our society. So in closing, as it relates to the children of Chicago and the children of CPS, how are the children? Thank you.
Thank you. Remember, money on the table, CEO Martinez is leaving it. We absolutely can access these funds, support social workers that we've heard from today, like Sheena and Stephanie. And thank you so much to our president from the National Association of Social Workers for driving it home about how desperately needed this money and these services are for our students. Next, we're going to hear from Dennis Kosuth. He's a CPS certified school nurse. The Healthy Schools campaign and this money also applies to fully staffed schools with nurses. Thanks, Dennis.
Good morning. My name is Dennis, D-E-N-N-I-S. Last name is K-O-S-U-T-H. Before I worked in schools, I worked at Cook County's emergency room, just down the street from here. And a front row seat in what healthcare looks like in the third largest city in the richest country that society's ever produced. And it was an appalling view. Healthcare for poor people, for people of color, black and brown, undocumented, is an outrage. And I can see the wealth. When you walk out the front door of Cook County, you can see the shiny buildings downtown, and you know resources exist in our society, but it's not going to where it belongs. When I left the ER to come work in CPS, I thought naively that maybe it would be better in schools. And I was sorely mistaken. The same kind of tragedies, the same kind of lack of resources that I saw at Cook County, I also see in the schools. I remember soon after the peak during the peak of COVID, I was teaching a class to second graders, talking about safety and health and how we can keep each other and our families free of disease. And a second grader put her hand up and said, "I want to share something. My grandmother passed away last week from COVID." And then her neighbor, who's staying right next to each other, next to this other student, also put his hand up and said, "My grandfather also just passed away from COVID." And this is the kind of trauma that our students are suffering and continue to be impacting them. Just weeks later, I was sitting in a meeting of clinicians talking about a family, a group of students who were struggling in their classroom. And we learned that they had left their foster home to go be with their mother for that weekend. The mom had just got out of the hospital. She had been released she was suffering from COVID. They said, "Oh, you can heal up at home." And over the night, that mother passed away in the same room with the 3 children. Could you imagine waking up to see your parent dead before you? But these are the kinds of things that Stephanie and others have talked about that are happening in schools. And as educators, we see these kinds of things, and we have no choice but to speak out, because we see the wealth gap between what the services that our students deserve and what they can access to. You walk through places like Goose Island, and you can see all the new fancy places that you can go and enjoy yourselves, and yet we can't seem to find the kind of funding that schools need to give the resources where they belong. And CTU has always been an advocate for that. I went on strike with all my coworkers to fight for a nurse in every school every day. So we put our money where our mouth is when it comes to advocating and fighting for things that we think that our students deserve. We mobilized heaven and earth to fight for those types of things. As a side note, we still don't have a nurse in every school every day, so we're still fighting and organizing for those resources. CEO Martinez talks about his 5-year plan, and I see a lot of work that CTU does in his plan. As educators, sometimes we tell our students, "Oh, don't copy your neighbor's work." But actually, I think it's fine to copy the work of CTU when it comes to advocating for the students, for the schools our students deserve, because we think those are important. We put our money where our mouth is, and we think it's really unfortunate that he's leaving money on the table when it could be put towards our schools and fight for the resources they deserve in terms of mental health, physical health, and all the rest of it. Thank you.
Thank you, Dennis. All right. So again, remember, money on the table. CPS Martinez can do something about this, can do something to help fully fund these schools. It's free money. All they have to do is bill Medicaid for it, but CPS has not set up the systems to make that so. So Stephanie and Sheena and Dennis have to make very tough decisions about which children they get to help at what point, because they have a list of things they have to do every day. All right, next, so pleased to bring up our AFT, the American Federation of Teachers, Secretary-Treasurer Fedrick Ingram. Thank you.
Hi, good morning, everybody. My name is Fedrick Ingram. I'm the Secretary-Treasurer for the American Federation of Teachers. We represent 1.8 million people in healthcare, in education, and in the public service space. It is indeed an honor to be here with the heroes and sheroes of this school system. People who save lives every day. People who, in quiet conversations, give hope and give opportunity to our young people. In a world that is going faster than we have ever seen it before, these are the people who slow it down just a little bit so that our young people can make good decisions, so that our young people can stay alive. We also know that suicide is the second highest cause of death for our young people between 18 and 25 years old in the nation. And so this is a public crisis. And shame on those in CPS who will not access monies that the federal government has made available through ESSER funds, made available through the Biden administration, and made available to our families, because we need this money. We need this money to fully fund our schools, to staff our schools, and to give our young people an opportunity to stay alive, to give our young people to be the best of themselves. That is what's at stake today. And so, Mr. Martinez, it costs you nothing. It costs you nothing to write a letter to make sure that the mechanics are where they need to be in CPS. It costs you nothing to access these funds that are readily available and that were given to you by the federal government. It costs you nothing to give your families hope and opportunity in the Chicago public school system. It costs you nothing to do the right thing, to support CTU, to support our efforts, to support these people who are saving lives every day. And so we just stopped by today from our national bus tour to let you know that, one, CTU, we've got your back, but two, more importantly, our young people are crying out for help. Our young people are asking us to do something. Our young people are depending on us to get this right. And so, Mr. Martinez, do the right thing. Do the right thing and get these funds into our schools. Help our social workers, help our nurses, help our healthcare system interact with our school system so that we can make a bigger, broader impact and a bigger footprint on giving opportunity and hope to Chicago students and families. Thank you so much.
Awesome. Thank you so much. Shout out AFT. Thanks for coming through. See that big bus over there? You rolled in. Okay. So I just want to point out again that CTU's contract demands, we're fighting for these resources. So we're fighting for having a ratio to a student to social worker ratio that falls more in line with what the National Association of Social Workers states should be. And we just heard today, remember that we're actually woefully, even that is under what our students need because of the amount of trauma and heartache that they experience every day. And now I'm so happy to bring up CTU President Stacy Davis-Gates. And good morning.
Good morning. Good morning. Stacy Davis-Gates, President, Chicago Teachers Union, STACY, DAVIS, no hyphen. Good morning. Our young people deserve the best out of all of us. Our young people deserve the advocacy, the support, the compassion, the love, the dedication, and the intention of grown-ups in every corner, every facet, every component of their lives. And the members of the Chicago Teachers Union, which number almost 30,000, have a very consistent relationship to offering all of those things to our young people. I am so glad to be here with Board President, Ms. Newson, of the National Social Worker Association, National Association of Social Workers, pardon me, because as a Chicago public school student, she had an experience that instigated this longing commitment to offer other young people an opportunity at processing grief and trauma, at clarifying their value and their worth, and taking full advantage of the opportunity we get every morning to lead this life. So I want to thank you. I want to lift up the other social workers that are here this morning. Sheena and Stephanie, our nurse, Dennis, who will every day this year do more because they have to do more. This contract cycle, I foolishly thought that we would have an opportunity to work with people to implement best practice. I foolishly thought that it would not turn into the days of our lives that are being covered in headlines and news stories every day. The news media has boiled this down to a loan. And you have people behind me who are telling you they don't have enough capacity, they don't have enough staffing, they don't have enough funding to offer our young people what they need. Our young people are experiencing a rapidly moving world that is anchored in the AI of social media. They are dealing with impossible standards to reach. And then on top of that, they are dealing with poverty. Over 20,000 of our young people are without homes, permanent homes. That is a daily traumatic situation. And the people behind me are trying to help them duct tape a care system together that helps them. And the only thing that I get to read about and watch and hear is that it's about a loan. God help Chicago get this one right. And God help all of these social workers who are doing the best that they can. Let's make this very clear. You don't need a loan for this here. Federal government, through the Medicaid program, another LBJ invention, is making money available to help children in Chicago. And the Chicago Public Schools is not taking advantage of it fully. That's the bottom line. You don't have to negotiate it. You don't have to fight for it. You don't have to hold press conference at the crack of dawn for it. You just get to get it. We have children that are eligible to receive it. Build the infrastructure so that our young people can get it. This is not unlike what we have requested and pushed for with respect to renovating our facilities and building new green facilities. Again, that too is federal money that is available to us. And when this union pushed the Chicago Public Schools to do so, there was like $50 million we won together. That's going to give us green, what are they? Electric school buses. Yeah, to get the kids who are not getting to school right now to school. But they didn't want to do that one either. We had to push and challenge. Listen, this is money that's on the table right now. They can have it. We want to work with them to get it. We'll take questions.
What's been going on for the last year, this past last year? Certainly there have been efforts to reach out. Has CPS told you why they haven't gotten the money? We've reached out this morning.
Well, there's always a lot of obfuscation with our district. And it continues to give us the understanding that there's a lack of leadership there. They don't have one answer. They don't have two answers. They don't have any answers. If you go back to our open bargaining sessions that we've had, and you can go on the CPS YouTube site, those sessions demonstrate a bureaucracy that is working without intention. And without, that is so dope. Shout out to that brother this morning. Solidarity. Solidarity. Yes, solidarity. Yeah, right? So, hey, that's sustainable. Right? Right, that's sustainable. We don't know. We get like different answers that don't make sense. You ask another question, you don't get it. It doesn't matter what the answer is. Can I be honest with you? I don't even care what the answer is. you know what I want them to say today after hearing all of this? I want them to just say, hey, let's figure out how to like work with you to implement this. They don't even have to tell me why they didn't do it. Just say, yo, let's get it done today.
And why, and similarly, why are we just hearing from you now, if this has been going on for a year? I mean, have there been other news conferences about this issue? Just curious about the time.
God bless you all for thinking that we are in charge of the system. For real. I hear this all the time. I want you to do me a favor though, and we keep a website. We keep all of our contracts on that website. We keep all of our previous proposals on that website. We have like robust social media, and we keep a lot of information there too. Chicago Teachers Union since 2011 has been the most consistent advocate of trying to win the schools Chicago students deserve. In 2019, we rang the alarm and said that we needed a social worker in every school and a nurse in every school, and we went on strike for that. What we've been trying to do lately is bring the volume down and to try and do what people have said that they wanted us to do, figure out how to work together, right? So we've spent a lot of time getting a lot of bad answers from CPS about why we don't have the funding for social workers. We've been spending a lot of time chasing terrible, unaccountable answers for why they don't get this money. So we didn't ring the alarm because people have challenged us to figure out how to work with them. And we've taken that challenge and we've tried to do that. And here we are today after failing to get CPS to take advantage of free money to say, hey, cameras, hey, microphones, perhaps this level of pressure can help us get an implementation, not just an answer. Thank you for that question. Well, I appreciate you all being here. These good people got to go to work. Have a great day.
Thanks, guys. I appreciate you.